the amazing tooth doctor, Dr. Peter Yoo, and we're here going to be talking to you about dental emergencies. Something that happens sometimes and you got to know what to do when it happens.
Yeah.
So St. Augustine said, the greatest evil is physical pain. And I would have to agree with that.
Yeah.
I recently had a gallbladder incident.
Ooh.
And it was not pleasant. You can't think about anything else but the pain. So I think he's onto something there. So 1 in 6 Americans experience a dental emergency in the past year. That's a huge number. So Dr. Yoo, tell me a little bit about what you guys do when you encounter a dental emergency and how available are you?
You know what? In regards to dental emergencies, I guess the first thing that comes to mind was back in school. I remember an instructor talking to us says, when you get out there, one thing to remember, don't give out your personal phone. Don't give out your cell phone to patients because they'll be calling you. And what I realized is, you know what? No offense, but people don't want to see me. If they can avoid it, they don't want to see me. So you know what? The person that calls me is actually in pain. So you know what? I give my personal cell phone out on my business cards to my patients because you know what? There are people out there that, who wants to be in pain at, 11 at night.
Mm-hmm.
So a personal story that I have to share is one of my patients. I get a lot of calls, sometimes when I'm on holidays, and I answer them to try and help people out. But a lot of times I will go into the office to see a patient. One patient came in, this is probably, I had a basketball game, and at 10 o'clock he called me. I went at 11 p.m. to meet him at the office. He just couldn't handle it. He didn't know what to do. He was taking T3s, a lot of strong painkillers, not helping. And he walked into my office holding 2 cups. One was ice water, one was empty. And he said the only thing that made his tooth feel better was ice cold water. So he'd be sipping or putting ice water in his mouth, letting it sit just to keep the tooth cool, and then spitting it out once it warmed up. And he'd be doing that. And he hadn't slept for maybe 2 days.
Oh, wow.
Finally, I said, why didn't you call me during the day? He's like, I thought it would get better, but no. So we got him in, numbed him up, got him some relief, and the tooth was infected. So we started a root canal that night, just open up the tooth, just kind of release some pressure in the tooth. Went home, got a good night's rest, woke up the next day, called our office, and the next time I saw him, he thanked me. He thanked me a whole bunch. He said, once I opened that tooth, his pain just went away. No more ice water. He was sick of ice water for a few days. Yeah, so, that's something that I thought was very important, and, just to help somebody out like that when really, even meds weren't helping him. So.
Well, that is so good. That's very rare. I haven't heard really any dentist who's doing that. I'm sure there's a few great dentists out there, but I know this guy is one of the best. The best in my books, but that's just me. So, hospital or dentist? Where should people go first in the event of a dental emergency? Let's say a broken tooth or something like that.
Well, obviously, if your dentist is open, you want to go see your dentist. If it's a tooth-related procedure. Now, they do have an emergency dental clinic at the university. I've heard of some clinics that they call themselves emergency dentists. But yeah, for us, I provide my cell phone, and I want to help my patients. I don't want to be rude, but sometimes I question what other dentists do, and so I want to have the best care for my patients and make sure that they're taken care of and get the right treatment for the pain.
Awesome. So, why is it best, in most cases, to go see your dentist as opposed to going to the hospital?
Well, a lot of times the hospital, they're not sure what to do, and
Okay.
so if you go to the emergency clinic and not the dental clinic but the emergency clinic, sometimes they'll come in and they'll just put you on meds and antibiotics, but that's only if the tooth is infected. Now, there are many other reasons why tooth can be in a lot of pain, and so seeing your dentist is important in terms of knowing what the actual pain is, right?
Yeah, so more specialized knowledge about different causes of tooth pain.
Yeah.
And that's important to have. Would you rather go to a specialist or someone who is a generalist or someone who would have no idea? Specialist, right? Someone who knows what they're talking about.
Yeah.
Awesome. That's what I would go to, number one. So, what are some of the most common emergencies that you see on a regular basis?
Most common emergency, I will have to say, is a imbalance in your bite.
Oh.
Okay. I tell my patients, 5 things cause pain. 1, most obvious, tooth infection. Okay, you got swelling, you got pain, your gums are hurting, your gums are red, your tooth is throbbing. There's, people know what an infection is.
Yeah.
Then there's a cracked tooth.
Hmm.
Tooth is fractured, broken, something's loose, or when they bite down, it really hurts. Okay, cavities. Some big cavities can start, be very sensitive, achy, more so related to the infection side of things. But again, you can get a big cavity that can bother you. Then there's trauma. Okay, trauma is like you've been to a hard nut, or I think my cousin, he was playing basketball, turned around, boom, the ball hit him right in the tooth, and his tooth was aching for a number of weeks. And then last thing, which I feel is the most common one, is an imbalance in your bite, where some reason your bite is hitting very heavy on one tooth, and it's caught to the point where the tooth starts aching and throbbing. That is one of the most common things that we treat, where we're not saying, oh, you need a root canal, or you need to pull this tooth out, and incurring all these high costs. The quick bite adjustment, it's a nominal, not nominal in the sense of the importance, but nominal in the sense of the invasiveness of the procedure.
Okay.
And even the cost is very minimal, and that a lot of times will solve the problem and the pain, and patients can walk out of here not having to lose a tooth or get a big procedure done. Yes.
That's fantastic. And it's good to know that a lot of emergencies aren't necessarily emergencies, but there's other ways and other things that can be done to help relieve pain and tension in the mouth, and that's a big relief. Relief. So, do you find that patients wait way too long getting treatment before they come and they're in an emergency situation?
I think that's majority of people, right? They say that 40% of the population has a fear of dentists because of what they've heard, what they've seen, and sometimes even personal experience, which is unfortunate. A lot of times people don't go to the dentist because of money, right? Finances. And then a lot of times they're too busy, and I can admit to being a culprit of that. I was supposed to go see a dentist. I had an infection, and at the time it didn't hurt for a while, so I kind of delayed. Finally went and saw them, but I know how people feel, and that's totally understandable.
Yeah. So what should people do if they get like a broken tooth or one that falls out? Like what do they do in that instance?
Well, let's first talk about the knocked out. Okay. If you have a tooth, a friend of mine playing hockey got accidentally elbowed in the face, his tooth popped out.
Wow.
Okay. 15 minutes. That's the key thing. You need to find that tooth, clean it as best you can. I don't care if you just wipe it or whatever, put it under, quickly rinse it. You have to put the tooth back in. Now, sorry people if it sounds a little bit gory, but he put his tooth back in within 15 minutes. The tooth and the bone kind of helped and kind of re-healed, and he kept his tooth.
Oh, wow.
He didn't lose his tooth. I had another story of a patient, a little girl in school, running around. I guess kids were playing a little bit of tag, and the little girl hit her face into the wall. The tooth came out. They went to the emergency clinic. The dentist was, I'm not sure if he was busy or not sure, just said, you should go see your regular dentist. Came to see me the next day. Well, that was more than 15 minutes for sure.
Yeah.
I couldn't put the tooth back in. And this was an adult tooth, not a baby tooth.
Oh no.
And unfortunately, a front tooth, adult tooth, the little girl, unfortunately could not replace that. And now we'll have to deal with that when she gets older. So.
Oh my.
Now with the broken tooth, sorry, I don't want to get this long. Broken tooth, first of all, is it painful? If it's painful, then you got to see something. Number 2, is it sharp, right? If it's cutting your tongue, your tongue's going to want to go towards it. So, a lot of times I see patients, I'll bring to the office, quickly just smoothing the tooth so that it's not cutting their tongue. But yeah, there are patients out there that break a tooth. It's not sharp, not hurting. You can wait a little bit, but again, go see your dentist as soon as possible.
Very good. Awesome. Well, thanks so much, Dr. Yoo. It's been very informative, and I know that this is going to help somebody out there. And if you guys are running into a dental emergency, go see your dentist. And if you're in the Edmonton area, go see Dr. Yoo. He's the guy to see at the Tooth Doctor. And you can visit us and book an appointment easily at thetoothdoctor.ca. And if you liked what you heard here, give us a thumbs up and give us some comments down below and subscribe to the channel. And we will talk to you guys next time.